Okay, good afternoon, everyone, and welcome to the daily COVID-19 briefing for the City of Philadelphia. To practice social distancing measures, we have all speakers joining us virtually today via Zoom, and we are going to begin with opening remarks from the mayor. Mayor?
Good afternoon, everyone. Thanks for being on. And I'd like to start today with some welcome news. You may recall last week we announced a one-year contract extension with the Fraternal Order of Police. And I said at the time we were in discussion
Stand by, folks.
Hi all, we are having a little bit of a technical issue with the mayor's remarks. I would like to ask Dr. Farley if he could go to his remarks at this time. Dr. Farley?
Okay, thank you. Can you hear me?
Yes.
All right. Good afternoon, everybody. We've had these press conferences every day for a few weeks now, and I've mainly been giving bad news. Today, the news is a little bit better. We are seeing a slowing in the growth of cases of coronavirus infection in the city. And as has been the past, our healthcare system is able to handle the patients that they're seeing. So let me give you more details. Since this time yesterday, we've received reports of 505 new cases of the coronavirus infection, bringing us to a total of 4,777. Now, the number of new cases we've been reporting in the past few days has been in the mid 500s. So the fact that we're at 505 today means it looks like we are stabilizing. I want to report again, recommend again to reporters that they follow those daily numbers, not the cumulative numbers, because the cumulative numbers are going to continue to grow, but the daily numbers, if we're successful, will start to fall. And if you want to follow the trends of this, and you don't remember the numbers I give you each day, go to our website, and you're going to see a graph there with trends. Now, those numbers will be somewhat different from what I'm reporting every day here because those are graphed by the day in which the test sample was taken. And there's a lag between when the test sample is taken and when we get the report. Nonetheless, you get a sense from the trends by looking at that graph. The overall good news is that the growth is slowing, but it's important to say that we can't assume that that slower growth will continue. This virus may find new populations, and we may see rises and falls before we ultimately see a sustained fall. So that's what's happening overall. We're continuing to see clusters of this infection in congregate settings like nursing homes and behavioral health facilities and the city's jail. We've had 4 new inmates who have reported testing positive since this time yesterday, bringing us to a total of 62. We're tracking the number of people who die from this infection, and sadly, I have to report we have 13 new deaths from this time yesterday, bringing us to a total of 78 deaths since the beginning of the epidemic. 32 of those people were nursing home residents. 53 of the 78 were over the age of 70. Now, the deaths will tend to lag behind the number of cases we have. So even when the number of cases starts to go down, we may still see afterwards some continued increase in the number of daily deaths. I know there's a lot of interest in the racial breakdown of people with this infection. We don't have good data on that for all cases. We have some data for people who have died of this. So of the 78 total, 22 or 28% were white, 30 or 38% were African American, 1 was another race, and 25, the race information was unknown to us. If you look at that distribution, it says that there are a little more African Americans than the general population in Philadelphia. We're about 40% African American and 40% white in the city. And so like many other health problems, we may see that this virus affects people who have other disadvantages more. They may be more likely to get the infection. They may be more likely to have severe disease if they do get the infection. So we at the city and the healthcare systems across the city are going to continue to work to be especially focused on reducing spread in the populations where it's spreading more, and to make sure that people, regardless of what advantages they have, can get adequate treatment for the infection. On testing, our availability was as is before. In general, testing is for people who have symptoms and are either healthcare workers or over the age of 50. If you go to phila.gov/COVID and go to FAQ, getting tested, there are links and phone numbers for all the different sites in the Philadelphia area where you can get a test. Citizens Bank Park will be open today from 1 p.m. to 6 p.m. Remind you that we'll discontinue that after Friday. Our Center City site is open 7 days a week. If you want to be tested there, call 267-491-5870. We continue to work with the city's hospitals and to track how they're doing. They are seeing a steady increase in cases of this infection amongst their patients, but they still have plenty of room for people who need treatment. Right now, there are 616 inpatients with COVID infection in the city, 1,062 in the Southeast Pennsylvania region. I was asked yesterday how many of those are in the intensive care unit. Unfortunately, we don't have good data on that. There are plenty of general medical beds, and there are plenty of intensive care unit beds, however, we know are available across the region. So what does this mean for the general population of Philadelphia? We have better news, but despite the somewhat better news, it's still very important that people are very serious about staying safe. The virus is still circulating. If we start behaving as we had before, with lots of social contact, there's no question that the virus will surge again. So if it's not essential for you to go to work, stay home. If you have to go out, for example, to go to work or go to the grocery store, keep your distance from people, 6 feet. And when you have to be around people, wear a mask. If you want more information, go to our website, phila.gov/COVID, or if you want medical questions answered, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. All right, I believe we have the mayor by audio at this point. So Mayor, I'm going to unmute you. Can you hear us?
I can hear you. Yes. Can you hear me?
Yes. If you could begin your remarks from the beginning. Thank you.
Okay. Well, everyone may recall last week we announced a one-year contract extension with the FOP. I said that at the time we were in discussions with the other three unions about similar extensions. So today I'm proud to announce that our administration has reached a tentative agreement with the leadership of District Council 47 for a one-year contract extension. This extension includes, effective May 1st, a 2% increase in each step of each pay range in the 47 pay plan. It also includes one-time bonuses of either $450 or $700, depending on whether the employee is working on site for the majority of their time. I want to thank publicly Kathy Scott and her leadership team at DC 47 for their willingness to step up and agree to a deal that I think makes sense for everyone. And I want to thank Deputy Mayor Rich Laser, Deputy Mayor for Labor, for his efforts in this regard. And I know this has been an unsettling time for all our members of District Council 47 and all of our city employees and all city workers. This extension will allow the city and the union to get through the turbulence of this pandemic. And by next year, we'll all have a better idea of what makes sense for a longer term deal. I look forward to ratification by membership of DC 47, and I look forward to continuing discussions with District Council 33 and Local 22. Now I'd like to share an important announcement about accessibility of some meal sites. Next week, there will be a temporary change in the school district's student meal distribution schedule. The 49 school district locations that distribute meals for students will be closed on Monday, April 13th. The sites will open instead on Tuesday, April 14th from 9 a.m. to noon. That's Tuesday, April 14th from 9 a.m. to noon. This is a temporary change in the regular Monday to Thursday schedule because the observance of Good Friday alters the packing schedule. 49 meal sites will be open tomorrow, Thursday in the morning, and will be open next Thursday morning as regularly scheduled. The 40 food sites where residents can pick up one free box of food per household will still be open on Monday and Thursday of next week from 10 a.m. till noon. Any resident in need of additional food is encouraged to call 311 for help finding a food site or a food pantry near them. Yesterday, SEPTA announced service reductions that are designed to preserve core services for essential travel. I want to stress, if you don't have an essential job, stay off of SEPTA and stay home. If you absolutely have to be on the system because you have essential personal business, like a medical appointment, or you are traveling to or from an essential job, give at least 6 feet of distance between yourself and other riders. Finally, because of the Good Friday holiday, there will be some additional changes to city services. As you know, city buildings have been closed to the public for several weeks, but essential services have still been continuing. This Friday, trash will not be collected. Residents who have collection on Friday should set out their trash on Saturday evening after 5 p.m. for collection. Recycling collections will resume next week as part of the curtailed schedule that was previously announced. All city health centers are closed on Good Friday. Then again, all city health centers are closed on Good Friday. The community-based testing site at Citizens Bank Park and the city-run COVID-19 testing site in Center City are both open. And Dr. Farley has given his update for the day, so this finishes mine.
Okay, thank you, Mr. Mayor. Armando?
Buenas tardes. Hoy comenzamos con buenas noticias. La semana pasada, la ciudad anunció una extensión del contrato de 1 año con el sindicato policial de la Fraternal Order of Police y que seguían las conversaciones con los otros 3 sindicatos municipales de trabajadores respecto a extensiones similares. Hoy nos complace anunciar que nuestra administración ha llegado a un acuerdo tentativo con el liderazgo del Consejo del Distrito 47 para extender el contrato por 1 año. Quiero agradecerle públicamente a Kathy Scott y a su equipo del Distrito 47 por su disposición a aceptar un acuerdo que es beneficioso para todos. Esta extensión le permitirá a la ciudad y al sindicato superar la turbulencia que representa esta pandemia. Ahora, quiero compartir con ustedes un anuncio importante sobre el acceso a algunos centros de distribución de alimentos. La próxima semana habrá un cambio temporal en el horario de distribución de comidas para estudiantes del distrito escolar. Los 49 locales del distrito escolar que distribuyen comidas para estudiantes estarán cerrados el lunes 13 de abril. Los centros estarán abiertos el martes 14 de abril de las 9 de la mañana hasta el mediodía. El jueves 16 de abril se retomará el horario habitual. Este es un cambio temporal en el horario regular de lunes a jueves, debido a que el feriado del Viernes Santo coincide con el proceso de empaque. Los 49 sitios de comidas estarán abiertos mañana jueves de 9 de la mañana a las 12 del mediodía. Los 40 centros de distribución de comida donde los residentes pueden recoger una caja de comida gratis por hogar estarán abiertos los lunes y jueves de la próxima semana desde las 10 de la mañana hasta el mediodía. En relación a los cambios debido a la pandemia, SEPTA anunció reducciones en su servicio con el fin de poder continuar ofreciéndolos. Queremos ser enfáticos. Si usted no debe realizar un trabajo esencial, no salga a la calle ni utilice el transporte público. Si usted tiene que usar el transporte público porque debe realizar una actividad esencial, como una cita médica, ir a buscar alimentos o ir a trabajar, por favor mantenga al menos 6 pies de distancia entre usted y los otros pasajeros. Finalmente, debido al feriado de Viernes Santo, habrá cambios adicionales en los servicios que ofrece la ciudad. Este viernes no se recogerá la basura. Los residentes deben colocar su basura en el local acostumbrado para su recolección el sábado 11 de abril después de las 5 de la tarde. Todos los centros de salud de la ciudad estarán cerrados este Viernes Santo. El centro de pruebas ubicado en el Citizens Bank Park y el centro de pruebas ubicado en Center City continuarán abiertos en horario regular. Y esta es la actualización en materia de salud para el día 8 de abril del año 2020. Hay una disminución muy pequeña en el aumento de los casos. Nuestro sistema de atención médica está manejando la situación adecuadamente. Desde ayer se han confirmado 505 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 4.777 casos en la ciudad. Hay 62 casos confirmados entre los reclusos. Reportamos también 13 nuevos fallecimientos en Filadelfia, donde un total de 78 personas han muerto debido a la COVID-19. 32 de los 78 fallecidos han muerto en hogares de ancianos. 53 de los 78 muertes han sido en residentes mayores de 70 años. La información disponible sobre la raza de las personas muestra que los fallecidos fueron 30 afroamericanos, es decir, un 38%, 22 blancos, un 28%, una persona clasificada como de otra raza, 25 personas de raza desconocida. Vemos de que hay más fallecidos entre los afroamericanos que entre cualquier otro grupo. Y estamos trabajando arduamente para reducir la propagación del virus y para darle tratamiento médico a todos aquellos que lo necesiten. Este virus no discrimina por raza o por género. Las pruebas siguen disponibles en los centros de prueba de la ciudad. En Filadelfia hay más de 20 centros de prueba. Por favor, consulte el sitio web philap.gov/COVID-19 bajo la pestaña FAQ para ubicar el más cercano a su hogar. Con relación al centro de pruebas del Citizens Bank Park, las pruebas en este centro finalizarán el día viernes 10 de abril a las 6 de la tarde. El centro de pruebas de la ciudad en Center City continuará atendiendo a personas mayores de 50 años y trabajadores sanitarios que presenten síntomas del COVID-19. Si cumple con estas condiciones, llame al 267-491-5870 para hacer una cita. Recuerde que debe ser referido por su médico primario o médico de cabecera. Los hospitales están preparados para atender esta crisis y se está viendo un aumento de pacientes hospitalizados, pero felizmente hay mucha disponibilidad de camas. Los pacientes hospitalizados con el COVID-19 son un total de 616 en Filadelfia, 1,062 en la región, y estos números van en aumento. A pesar que hoy hubo una disminución en los casos reportados, tenemos que observar las medidas de permanecer en casa. El virus sigue circulando en el ambiente. Si nos comportamos como antes y no cumplimos con la orden de permanencia en casa, el virus se propagará rápidamente. Por favor, si usted no es un empleado esencial, quédese en casa. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos, usar máscaras de tela en lugares públicos donde las medidas de distanciamiento social sean difíciles de mantener, especialmente en áreas de transmisión comunitaria significativa, como por ejemplo los supermercados o las farmacias. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Si tiene usted preguntas de carácter médico, puede llamar las 24 horas, los 7 días por semana al 1-800-722-7112. Y esta llamada es gratuita. Muchas gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media who are logged in. So I would like to ask our speakers at this time to, again, join us with your video and audio on. Just please remember, we do have limited time during these briefings, so we are asking that one representative from each media outlet to ask questions, and we ask that you please limit your questions to 3 or fewer. We will do a second round if time permits. And for those who are logged in today, if you please use the raise your hand feature, it can be found under the participants list. We will go ahead and unmute you one by one to answer your questions. Okay, first up we have Mitch Blocker with NBC 10. Mitch.
Thank you. Mr. Mayor, have you been tested for COVID-19?
Mayor, you're unmuted now.
Yes, can you hear me?
Yes.
Okay, I've not been tested. I don't have any symptoms. I'm certainly in the age range, but thankfully no symptoms. I continually take my temperature and check my oxygen level in my blood, so I'm okay so far.
Sir, did the city have? Yeah, thank you. Did the city have a pandemic plan?
I can answer
Yeah,
that.
Okay.
Yes, we did have a pandemic plan. It had been put in place a number of years ago, but that plan did exist, and we used it as a foundation for our plan going forward.
And Dr. Farley, I have a question for you as well. Is the city sharing with you essential city staff who are symptomatic or at risk?
No, the health department is receiving reports of people who have the infection from laboratories. So we're not tracking whether people who have those infection are, what their occupation is. If we, when we have a positive report, we try to contact the patient, the person, and then their employer about protecting the contacts around them, have them be quarantined. But no, we're not having the primary responsibility for tracking the symptoms of city employees.
Thank you all.
Thanks, Mitch. And if we could ask everybody logged in today to please just address your question to who you would like to answer it, since we are all remote, that will help us today. Thank you.
Wendy gets in here.
So now we are going to go to Pat Loeb of KYW.
Thanks. This is for Brian. And I really don't want you to get angry. So if you can give me a second to set the context for this. Our listeners, who are the people that pay the salaries of the officials here, and sick leave for police officers who are sick and quarantined, are asking us how many police officers have tested positive. They want a number, no names, ages, or any other identifying information that would compromise anyone's confidentiality.
Sure.
So I'm asking you, how many police officers have tested positive or are in quarantine?
Sure. So we did, as I said yesterday, we did have a conversation about the city's posture last night with our leadership team that included certainly myself and the mayor and Dr. Farley, but also included our communications director, our chief of staff, the fire commissioner, the police commissioner, our solicitor, among others. And we have decided not to change our posture at this point. And I recognize that I was not sharp, or my thoughts weren't particularly well organized yesterday. So I'm going to try and do a little bit better today. And I apologize for that. But the city's health department does have access to highly confidential information, data on HIV and tuberculosis, and certainly COVID-19. If we start to share that information with doctors, will no longer want to report that information to the city, and our ability to manage infectious disease will be limited. The health department has a very bright line about not reporting any data that might be used to try to identify individuals with a reportable disease. And so even in these challenging times, people, public servants included, have rights to privacy and confidentiality. If we reported the number of police officers with this infection, some of you would want to know what unit they were in. If we reported the number of firefighters with this infection, you'd want to know what station house, you'd want their ages. And eventually you'd either figure out who they were and report it. And I know, there was reporting on a specific station house earlier, or you'd or you think you'd figure it out and report it anyway. And that frankly doesn't really respect the men and women who are really dedicated to this city and put their lives on the line for our residents. Now, there are 6,500 police officers in the city, close to 3,000 firefighters, and we expect a certain number of them to test positive. But just because they test positive doesn't mean that they were exposed through work. They could have been exposed at home, through friends or family, and each one of those cases is tracked down to identify where that exposure took place. Likewise, doesn't mean that we're putting on the public safety at risk either. Our top priority is to keep our staff and the public safe. So when someone does test positive, they're taken off shift. We trace their contacts, we notify their contacts of the situation, and that does include the public. There's no risk to public safety, and there's no benefit to telling you whether there are 10 police officers or 50, as long as we're able to maintain our deployment levels and our service levels. If we ever get to the point where we don't have adequate coverage or need to use mutual aid to cover those core services, we'll certainly make those actions public. We're not going to hide from staffing shortages or our efforts to meet staffing demands or service levels were disrupted. We'll be very transparent, just as we were when we had to curtail recycling. And I certainly, to your point, Pat, I certainly understand that we're all public employees. And because our salaries are paid by taxpayers, some of y'all feel that we should have greater insight into our private lives, and I appreciate that. But when it comes to private confidential health information of our employees, there's going to be a bright line, and I'm not going to cross it. And we, the city, collectively have decided we're not going to cross it. I hope you all can respect that. I don't intend to continuously address this question. I think the city's position is clear, and certainly appreciate y'all's understanding as we continue to address this crisis going forward.
That was a really long no. Okay, thanks, Brian.
Pat, did you have anything else?
Nope, that's it. Thanks.
Okay. All right. We are now going to go to Laura McCrystal at the Inquirer. Laura?
Hi. I'm wondering about some statements made on television this morning by Dr. Deborah Birx that, federal officials and the CDC are now looking at Philadelphia as a, upcoming or new hotspot for this virus. That certainly doesn't necessarily jive with what we just heard from Dr. Farley. So I'm seeking a reaction to that and where that might be coming from federal officials.
Yeah, I heard about that comment this morning. And am I on?
Yes.
Yes.
Dr. Farley.
So Philadelphia, like other large cities in the Northeast, has been hit hard by this epidemic, with New York City clearly being the epicenter of the epidemic. And I'm sure she's looking at some of those numbers. I don't know exactly what number she's looking at. And I doubt that she's looking at numbers as updated as we are. So I'm glad that she's concerned about Philadelphia. We have been hit hard so far, but at the moment, things are looking a little bit better.
Okay. And, had the city previously been...
And we're prepared for any surge.
Okay. Had the city previously been in touch with anyone at the federal government or CDC who had, prior to those statements this morning, said to Philly, hey, you guys are an upcoming hotspot?
My staff talked to people at the Center for Disease Control routinely, I think probably every day. There wasn't any conversation that I was aware of where they single us out over any other city. All the high density cities of the Northeast are getting hit pretty hard by this. But as the mayor said, we put in place a lot of actions to address it, including our social distancing measures, which look like they're showing some effect.
Okay. And since those statements this morning, has anyone from the city reached out to federal officials and said, hey, where did you get those numbers or what's going on here?
I heard about that about an hour ago, and we haven't had a chance to track it down since then.
Thank you.
Okay. Thank you, Laura. Next, we have Matt Petrillo with CBS 3. Matt?
Hey, good afternoon. Thank you so much for your time. We've been seeing officers wear those face masks that were given to them by the city, but some of them are not correctly wearing them. Dr. Farley, this is for you. I was wondering just what you make of them. They're not covering their noses. They're not tied properly. They're touching the insides of them. What do you make of that?
So we recommend that everybody who was around somebody else and within 6 feet, be wearing a mask, and that mask should cover their nose and their mouth. Now, with the large number of police officers here, they've gotten training. That doesn't mean that everyone is going to be following the training all the time. And so I'm sure the police department will be working to try to improve how they use those masks. It's brand new, but we recommend that everybody use it to cover their nose and mouth when they're around other people.
Okay. All right. Thank you. That was it.
Thank you, Matt. Next, we have John Kopp with Philly Voice. John?
Hi, yes, this question's for the mayor. The Friends of the Wissahickon has reported seeing peak levels of visitors in recent days, including some group gatherings in the park. And yesterday, New Jersey closed its state and county parks after seeing a similar thing. So I was just curious whether the city's considering closing its parks at any point, or what it would take to do so, and then just how concerning it is to see, group gatherings in the parks.
Well, it's very concerning to see group gatherings. Again, we've attempted to give people with the appropriate precautions the ability to exercise and to get some time out of their imprisonment. But that's not off the table. And if it continues and we start seeing numbers that are more concerning than they are already, that's certainly an option for us to do. But it's not imminent at this point.
Thank you. That's it.
Okay, thank you, John. Next, we have Martin Pratt with Philly YBN. Martin.
Thank you guys for doing this, and sorry for the background noise. Quick question, Brian. Based on the report about us being a possible hotspot, are there any plans for increased testing sites? And we see an uptick in numbers, particularly in areas where we know that the numbers are high, which are predominantly African American or Hispanic communities.
I think that might be more appropriate for Dr. Farley on testing sites.
So yeah, we have, as I said before, more than 20 testing sites across the city, and including we made sure that testing is available in West Philadelphia, North Philadelphia. We have a problem with availability of testing overall. There's not enough of the swabs, and there's not enough laboratory capacity. Turnaround time is too slow. I think we will eventually get past all that. When we get past all that, I would like to increase the number of testing sites citywide. But at the moment, I feel like we have adequate coverage given the limitations on the total tests we can do.
Sorry, it looks like Martin muted himself. Martin, if you have other questions, there you go.
Sorry about that. Yeah, one more question. This is definitely a Brian question. Is there any work being done on creating a committee for what happens after Corona?
So we have started to look at kind of, what our next steps are. We're very early in that conversation. It'll be the same unified command group that is gathered today, which is Dr. Farley, the mayor, myself, Commissioner Teal, Commissioner Outlaw, Chief of Staff, the city solicitor, our Chief Administrative Officer, Stephanie Tipton, our Finance Director, Rob DeBow, and certainly our deputies for emergency management, and my first deputy, Tumar Alexander. We'll begin those conversations, and then I think we will likely spin out additional action items from there. But we're very early in that conversation. But we recognize that part of this is going to be our budget conversation as well. And so I just want to kind of recognize the mayor's announcement yesterday that in order for us to get through this, we're also going to have to figure out how to what our economic recovery looks like as well, and that's going to include city services. So again, early in that conversation, but we are starting to think about it.
Okay. Martin, I think that's it. Did you have anything else?
Nope, that was it. Thank you.
Okay, thank you. Next, we're going to go to Max Marin at Billy Penn. Max.
Hi, everybody. Thank you again for your time today. Just two questions. This one is for Brian. Of the $5 billion that Pennsylvania is poised to receive from the stimulus package, have you had any conversations about how much Philadelphia is slated to get and where that money would go yet?
Not yet. We are continuously analyzing the stimulus packages and looking at how to best maximize those dollars. But I don't have any details of where and how they'd be spent yet.
Okay. Do you know when you'll have those details?
Off the cuff, no. I can see if we can't provide everyone a better update sometime next week, though.
Okay, that's fine. Just one more thing for you, actually. Is there any updates about other surge sites? Has the city come to any agreements with other property owners in other parts of the city concerning just the number of like overflow beds.
Sure. So we're in conversations with a couple of sites for hospital surge capacity, but we don't have anything to announce at this point.
Okay. Thanks, Brian.
Thanks. All right, now we are going to go to Walter Perez with 6 ABC.
Hi, can you hear me?
Speak up a little bit.
Is this better? Can you hear me?
Yes, thank you.
Question for Brian. It's really 3 questions, Brian, mostly revolving around numbers. Is there any information about the rate of infections at homeless shelters? How many city employees have been furloughed and or laid off at this point? And how many people have checked in at the quarantine site at the Holiday Inn? And how much is the city paying for that?
Sure. On shelters, we're very concerned about all of our congregate care facilities, and we are aware of some infections at shelters. I can't give you the specific numbers off the cuff, but we are aware of serious infections and impacts to services because of those infections. We're aggressively trying to work through that with the health department and our service providers. We have not furloughed any staff at this point. Certainly, we're working through our budget and the implications of our budget, and everything is on the table at this point, and so that may change. And then finally, on the check-in of the Holiday Inn, I have to get back to you with numbers. Those numbers were changing rapidly this morning. I don't have an update, but we can get back to you with a specific number later this afternoon.
Okay. And how much is the city paying the Holiday Inn for that?
So at this point, we're not going to release the information on payment, mainly because we're also negotiating with other property owners. So we will release that when all said and done, but we're not going to release it at this time.
Okay, thanks, Brian.
Yep.
Thanks, Walter. Now we're going to go to Wendy Saltzman with NBC 10. Wendy?
Hi, can you hear me?
Yes.
My questions are for Dr. Farley, please, and I have 2 questions. The first one is, why do we think that the number of infections in the African American community are growing disproportionately? What do you attribute that to?
I can only speculate. I can't say for sure. One may be that they may live in more crowded conditions, and we know that anybody who's living in more crowded conditions comes in contact with more people, so is more likely to be infected. The other possibility is that the African Americans tend to have more chronic illnesses, and so if they get an infection, they're more likely to have a severe infection and come to our attention.
So is there more that needs to be done to address that community? So is there more that needs to be done, and what are you doing to make sure that this issue is being addressed in the African American community?
Well, there are 2 main things we're doing right now in our overall strategy. One is the social distancing to try to prevent infections overall, and that protects everybody. We need to make sure that message gets out in the African American community just as it does citywide. And that's among the things that I've talked to the Council President Clark about, that making sure that they get it out through their networks to all communities, but particularly African American communities. The second thing we're doing is making sure that the healthcare system can take care of anybody who is sick. Right now, the healthcare system absolutely can do that. People can go into any hospital emergency room in the city and they can be seen, and if they need to be admitted, they can be taken care of there.
When we talk about social distancing, are there challenges if there are people in different socioeconomic groups where potentially they're all living in houses together? Do you have advice in those situations?
It's certainly tougher if there are many people living in a small house or small apartment. They're going to be more in contact with each other. It's going to tend to be greater risk. Not much we can do about that other than really driving home the point. Try to keep your distance from people. Wash your hands when you're around people. Wear a mask. And if you have symptoms, and you're not young, if you're beyond age 50, then come and get a test and get attention.
Any additional health care, like targeting specifically the African American community, resources, efforts, educational or medically, that need to be pushed at this time?
Yeah, it is. Whereas we think that based on the deaths, there may be higher rates overall in the African American community. This still is really a citywide problem. It's a message we want to get to everybody, and everybody needs to take it seriously, because it's going to spread from one population to another if we don't. So the messaging that I think that they're hearing pretty consistently from you as well as us is stay home unless you have to go out. If you have to go out, wear a mask, stay away from other folks.
Okay, thank you so much.
Thank you, Wendy. Next, we have Brian Mendoza with NBC 10 Telemundo. Hi, Brian.
Hello, everyone. Can you hear me?
Yes, Brian.
Hola, Armando. Buenas tardes. Mi primera pregunta es, ¿en qué rango se encuentra la comunidad hispana en cuanto a ser afectados por infección o por muertes a causa de coronavirus?
Y la pregunta va para el comisionado Farley, me imagino.
Correcto, sí.
Dr. Farley, in what range does the Hispanic community fall in terms of being affected by infection or deaths due to coronavirus?
It's a good question, and I wish we knew the answer to it, but we have very limited information on race and ethnicity. And so you saw the information I had on race and deaths. It did not indicate which ones were Hispanic. That doesn't mean that the Hispanic and Latinos are not being affected. We may just not have that information. Likewise, on our cases, we don't have that information. So I'm sure it is spreading amongst people, Latinos, but unfortunately, I don't have numbers for you.
Es una buena pregunta, Brian, pero no tenemos esa información. Como están viendo ustedes, la información que nos están proporcionando en cuanto a raza y etnicidad es limitada. Y ustedes podrán ver que no se ha indicado que sean hispanos o que sean latinos que no estén siendo infectados. Por lo tanto, podemos esperar de que haya infección, pero estos datos no se están compartiendo, por lo tanto, no tenemos esa información en este momento.
Gracias. La próxima pregunta también es para el doctor Farley. De acuerdo al CDC, las muertes previamente pronosticadas pudiesen ser mucho menos por la orden de quedarse en casa y la práctica de distanciamiento social. Pero ¿cómo los residentes deberían tomar esta noticia para que no se confíen y haya posiblemente una segunda ola de propagación, especialmente entre las comunidades de bajos recursos?
Thank you, Dr. Farley. This question is also for you. According to the CDC, the previously predicted deaths could be much fewer due to the order of stay at home and the practice of social distancing. But how should residents take this news so that they don't become overconfident and there's a second wave of spread, especially among low-income communities?
I do think it is important that people take this seriously, and that's why I made those comments earlier today. Whereas we see some evidence of good news, of slowing of the number of new cases, I don't want anybody to take that as a signal that they should stop doing social distancing. The virus is still out there. It's in every zip code. It's in every neighborhood. It's in every population. And if people start coming in contact with each other again, there's no question that this virus will surge. And given the number of cases we have out there right now, it could surge very quickly. So I will try to continue to get that message out about how important this is right now. And I hope you'll help me out with that.
Esto es muy importante porque, visto por los comentarios que se mencionaron anteriormente, las buenas noticias respecto a la disminución del número de casos no significa de que el virus no esté presente todavía en nuestras comunidades y que se den la señal equivocada de que debe detenerse la práctica del distanciamiento social. Por lo tanto, voy a pedirles a todos los demás que me ayuden a transmitir el mensaje de que este virus pudiera resurgir y pudiera esparcirse rápidamente nuevamente. Medidas para evitarlo.
Gracias. Y la última pregunta, tal vez creo que sea para Brian o para el alcalde. El periódico Inquirer reportó que la ciudad ordenó 500,000 de máscaras para la policía y bomberos, pero presuntamente nunca llegaron. ¿Ellos pudieran comentar o aclarar esto?
This next question may be best suited for Brian or for the mayor. The Inquirer magazine newspaper reported that the city had ordered 500,000 masks for the police and the fire department, but presumably they never arrived. Could you please make a comment and explain about this?
Yes, we ordered 500,000 masks, which were actually going to be used for not just our city staff, but also for the healthcare system. Unfortunately, that shipment was disrupted. I don't know why, and that order was canceled. But we're pursuing multiple other options around masks for our healthcare system.
Sí, en realidad ordenamos 500,000 de máscaras que se iban a distribuir no solamente para nuestro plantel en la municipalidad, sino para los trabajadores de la sanidad de nuestro sistema sanitario. pero hubo algo que se interrumpió en este envío y esa orden se canceló y estamos viendo diferentes opciones múltiples para poder lograr el suministro de estas máscaras.
Muchísimas gracias, Armando.
Thank you very much. Gracias, Brian.
Thank you. We are going to our final round of questions. So if anyone has extra questions, please raise your hand. We are going to go to Mike D'Onofrio of the Tribune.
Mute myself. Okay, there we go. Can you hear me?
Yes.
Okay. So I wasn't sure. I got the racial breakdown for deaths in the city, but I wasn't sure. Dr. Farley, did you give the racial breakdown, however incomplete it is, for the testing for those who have tested positive?
I did not. As I've said in previous days, more than 85% of those, we have no information.
Right.
And to the extent we're getting information, it's from very just specific laboratories. So it comes to different channels. So the information we have is probably pretty biased. If I thought it was accurate, I would give it to you, but I don't think that that's really meaningful. So I know people are very interested in the racial breakdown of what we know, but I'm giving you what we know that I feel has some validity to it, which is the data on deaths.
All right. And I heard, the other question too regarding this, but does the administration have a plan to take any further actions in predominantly African-American neighborhoods should more racial data come in, considering that African-Americans are seeing, higher rates of infection and deaths in other cities?
So, again, our primary strategy right now really is messaging around social distancing. We are giving that citywide. We are also, I believe, working with some minority targeted newspapers. We're working with the city council. If there's ways that we can be providing that messaging more directly to African-American communities, I welcome that. Suggestion how we can do that. I'm going to be talking to one of the radio stations tomorrow about this. That's our primary step right now. Now, in the future, when we maybe have more rapid testing, when we have other strategies, then there's clear we're going to make sure that that needs to be accessible in the neighborhoods where we see higher rates of disease.
And maybe just lastly, do you think those trends in other cities also apply to Philadelphia? I mean, I know the fatality rate for African-Americans is lower than the population rate for African-Americans in the city, although I know that the death rate is incomplete. But do you think those trends in other cities apply to Philadelphia?
I've been pretty busy with this, and I haven't spent a lot of time looking at the epidemiology in other cities. And I've looked a little bit in New York, but I don't know about the others. So all I can speak to is what the data is telling us in Philadelphia.
All right.
Anything else, Mike?
No, I think that's it.
Okay. Now we're going to go to Pat Loeb. Pat?
Dr. Farley, I'm sorry. I missed the beginning of your initial remarks. You may have explained this, but why do you say that the trend seems to be easing off? Over 500 new cases seems in line with what's been happening the last few days. What is different? Why do you see hopeful signs?
That's exactly it. So that the number of new infections is the number that I am most interested in following. And that number appears to have stabilized over the past few days. If you look before then, that number was rising pretty steadily and pretty quickly. So the fact that it is stabilized and not rising is a sign that the growth is slowing. I'm not saying it's turning around. I'm not even saying that it's becoming plateauing, but the growth is slowing.
Okay, thank you.
Okay, thanks, Pat. And our final question will be from Mike D'Onofrio again at the Tribune.
Thanks. I forgot to ask this one thing. So I don't know if you said this already, but do you expect to ever get more detailed racial data for testing deaths and hospital patients in the city?
Ultimately, we'll get it for deaths, but that information tends to lag behind. As far as in the early going, we could do case investigations for each case. We're getting 500 per day. We can't do that. If the numbers of new cases each day drops to something lower, then we'll be able to investigate each case, in which case then we'll get the racial data in a way that's enough to be valid. And then we'd be happy to report at that point.
Okay.
Okay. Thank you, Mike, and thank you all. That concludes our daily briefing. Brian, I just has another announcement. Go ahead.
Two quick updates. I apologize. One, I wanted to get back to, I think it was Walt's question. There are 12 people currently at the Holiday Inn, and we expect that number to grow over today. We also, I just also wanted to clarify something in the mayor's remarks. which were is that trash pickup that is normally scheduled on Friday is scheduled for Saturday. I think he said to put trash out after 5 on Saturday. Folks should put trash out after 5 on Friday for Saturday pickup. So just wanted to make that clarification. That was a mistake in his in his written remarks, and we caught on the backside.
Okay, great. Well, that concludes our daily briefing, everybody. Thank you for joining us.